Doctors, we are going to discuss some important video-based, that is, specially videos which are important for your upcoming NEET exam, also for your Fmge exam and Inicet. But now for NEET PG, we'll see what are the important things that can come from microbiology videos. Okay, so first we'll start with the motility only because motility is one very important thing for diagnosis. Diagnosis, we give a provisional diagnosis based on the motility of that particular microbe, and the clinician will start the treatment. So let's see what are the important things we have here. Look at this image. Look at this image. You see the bacteria here, it's moving very fast. You cannot trace the path of that bacteria. So what does it mean? So when you know that is that type of motility, that type of when you cannot trace the path, or it looks like a shooting star, which is also called as darting motility. So the motility which you're seeing here, the first one, it is basically the darting motility. Darting motility. The first one is darting motility. You saw it was moving here and there, and you cannot trace. Once again, I'll play it for you. So this darting motility is characteristic for which one you know. Either it is Vibrio cholera, or cholera. In cholera, it's very characteristic. Also in Campylobacter jejuni. Campylobacter jejuni. So only difference between these two, in Vibrio cholera, it is the clinical features watery diarrhea, rice water diarrhea we call, more we call rice water diarrhea, whereas in Campylobacter, it's a bloody diarrhea. Bloody diarrhea. Okay, and then both are food poisoning. The characteristic Campylobacter also as a complication go to GBS, Guillain-Barré syndrome, autoimmune disease. You know that. Okay, fine. So once again, let me come and show you the picture here. Look at the picture. So you can see this, no, darting motility. So it's a darting or shooting star motility where you cannot see the motility. Okay, that's all. This one is done. What about the next one? The next one, see the second image. What you're seeing here is, you're seeing this beautiful corkscrew motility. Basically, it is a spirochete. It's a spirochete having corkscrew motility. So when this type of corkscrew motility comes, spirochetes, as we told. So what are the possibilities here? So now what I'm going to do with you, I'm going to list it out. You must be knowing it also. So this is the corkscrew motility. Corkscrew motility just looks like a snake, like a corkscrew only, right? So corkscrew motility, when you talk about the corkscrew motility, the characteristic ones are, spirochetes. Spirochetes. So in spirochetes, there can be a history of syphilis. They'll give you painless ulcer and they give this video and tell you to find. So that is Treponema pallidum, caused by Treponema pallidum. Or the second one, they could easily give you one of the Borrelia species. Borrelia, especially Borrelia burgdorferi, they might give relapsing fever. Though we have a Lyme's disease also, but in Lyme's disease, this motility is not characteristic. You will never, as a diagnostic, you will not see, very rarely you will see this spirochete. So that is out. So borderline relapsing fevers, they can ask a third most important, that is your Weil's disease. They might give you history of a Weil's disease, which is caused by Leptospira. So these are the three things, okay? Borrelia, Leptospira, Treponema pallidum. One of these things, according to the clinical feature, they might give you. So it's one of the spirochetes. It should be one of these three, okay? Borrelia, Treponema pallidum, or Leptospira. Okay, so please remember these two motilities. Okay, corkscrew motility of spirochetes and darting motility of Vibrio and Campylobacter jejuni. Okay, next one. We got the next one. Look at this image now. Now here you can see first one. I'm going to show you now. Yeah, look at this. Here you can see. Okay. Look at this. You're seeing the first image, the leaf is falling down. It's like something like a leaf-like structure that is falling down. A leaf-like structure which is falling down, right? You're going to see this leaf-like structure falling down. Once again, I'm going to play for you. See carefully. There is the structure leaf-like which is falling down. Okay? Leaf-like structure which is falling down. Right? Okay. Look at the other image. The second image, what do you see? This also somewhat look like a leaf, but it's not like a leaf. It is more what you call, it is twitching. You call twitches. Okay, it's twitching. See, with the single flagella, and it's all twitching. But both of these parasites, they're looking similar. Both of them looking like a pear shaped only. But yeah, let's come. So the first one, I will now going to write for you. Let's see what are the things. I think you identified it by the time. The first one which you're seeing was a falling leaf. It was a falling leaf motility, characteristic for, Giardia. Giardia, it was like this. It has 2 nucleus and 8 pairs of nucleus, right? One, and totally, it has totally 4 pairs, that is 8 flagella it has, okay, 2 nucleus. This is trophocyte of Giardia. Giardia trophocyte, first one. So which is causing steatoria, you know, very characteristic steatoria. Steatoria characteristic, that is foul smelling diarrhea. What about the second one? Second one, you saw it was like this, but it has only one nucleus and the flagella is not very clearly you see, but you know, we have anterior 4 flagellas and posterior 1 flagella, right? But there's only single nucleus. Single nucleus. This is very characteristic for your Trichomonas vaginalis species. Trichomonas vaginalis. So Trichomonas vaginalis, basically what it causes, so you might have a clinical history of a profuse green frothy discharge. Profuse green frothy discharge. Exact question, repeated question. Profuse green frothy smelling, sometimes fishy smelling discharge. This is characteristic. Okay, so you can have this image or this image, both looks very similar, but based on the clinical history you're going to identify one of them. Okay, that's all. This is for the second parasite motility, which is very important. Okay, you can very high chance that you might get question from this thing. Now there's also other two motilities. If you remember, look at this one, the first one. You see what's happening? You see that concentric circles there in this image, the concentric circles which you see, those are swarming. Those are swarming motility. Okay, and we'll write about the examples you know already. So this is swarming motility. Look at this one. This one, you see this bacteria. See, it's so fast, but it's like tumbling. It's not like it's not, you cannot trace the path like darting motility. Darting motility, you cannot identify. It just goes fast. But here, the bacteria is there, but it's like an alcoholic patient. You see, it's just rotating like an alcoholic patient. Tumble like this, right? So tumbling motility, right? So see this tumbling. I think already you guessed what are the bacteria. Still, we are going to write it now here. So first one for the swarming motility. For swarming motility, it is, you know, very characteristic. Three, we remembered swarming motility means we're thinking about 3 girls, Prochita, Sahara, and V. Pauro with Tea Party, we remember. But characteristically for Proteus, okay, you in exam, mostly they'll expect you to remember Proteus species. Having swarming motility to check whether they're same species, not different species, you're doing the Dines phenomena, right? That you know, Dines phenomenon. Dines phenomenon to check whether the Proteus species same or not we're doing. That's one thing. But apart from that, Vibrio parahemolyticus, don't forget hemolyticus, that is that the one from the seafood. Okay, in the Proteus. So Proteus, basically what happened, mostly will have history of UTI, and that stone, you remember, staghorn stone. Staghorn stone they might give you and they will tell you to identify the culture this was there, identified. Or they might give Vibrio parahemolyticus, which is, you know, food poisoning due to seafood. Especially I told to remember her girlfriend Kanagawa phenomena, in the which I told remember Goa, Vaga Beach, Baga Beach met Vaga Beach. In Vagatsumo agar, there is a high salt because there is a halophilic bacteria. So in high salt Vagatsumo blood agar, they grow colony. That's it. Okay. And then Serraceous, not much asked a question. And it's a red pigment producing bacteria. With that, Clostridium tetani, Tea Party, we told Clostridium tetani. Also not much asked. Okay, fine. Now, this question, as we know, the second one was a tumbling motility. Tumbling motility, when you give like this an alcoholic patient tumbling, we remember that girl, tummy, Lisha, who's having tummy. We told at the age of 22, she was active. At 37, she is not active, right? So, active, that is motile at 22 degrees Celsius. At 37 degrees Celsius, is non-motile. So, this is called differential motility also. Because of this, we also call it as the tumbling motility or differential motility. So this is characteristic for your listeria. Lissa, tummy Lisha. Listeria monocytes. Usually again you will have a food history, refrigerated food. Refrigerated food history can be a question, or you have a child that is neonatal sepsis or meningitis. Usually meningitis or sepsis history will be there. So this is very characteristic for our Lisha. Okay, that's all. You have to remember all basic things only. Okay, it's like a short revision. Right, so these are the main modalities we have in our microbiology. So you have to know this thoroughly because examiners love it, and this is also give for a clinical purpose also very important. Okay, we identify based on this. Now, look at this question. Video. So here a lady is taking some pouch. First of all, she gave something to swallow, and for 15 minutes, then she's taking some. This is some instrument that is a breath analyzer. Okay, so he had first some tablet he had, then he's doing breath analyzer. Now, after that, his breath. The breath means it's a what comes to your mind. I know that what should come. He's putting it to the analyzer, breath analyzer, and checking for the urea. Okay, checking for the urea ammonia compound. So the initially was taking capsule urea capsule, and then accordingly they're measuring the how much breath is coming. That is the urease breath test we call. So this is basically your urease breath test. So this is urease breath test. This is called urease breath test. And this, they might ask you, very characteristically, it's a rapid test and also for check the prognosis after taking the treatment, everything for H. pylori. H. pylori. H. pylori. Okay, and very characteristically, it causes gastric ulcer and first duodenal ulcer more, followed by the gastric ulcer, and very common cause of gastric carcinoma. Okay, not duodenal, gastric carcinoma and your maltoma are the characteristic features of H. pylori. So to check for this gastritis and duodenal ulcer, gastric ulcer, you're doing this urease breath test. Okay, that is very important in this thing. So if they give any breath like analyzer image, you think about H. pylori, right? That's all. So next one, next image. Next image. Yes, look at this one. So again, this is very, very important. Both are important for the antibiotic sensitivity. So we're going to check that one now. So first image, look at this. In this image, this our technician, he is putting a swab on the some culture media, and then she's putting the antibiotic disc. You're seeing a small disc placed. You see in this culture media there are 6 discs she's putting. So, okay, so you got it. What I'm talking. So she took a culture plate that is basically Muller-Hinton agar. Then she placed the disc there. That's the antibiotic disc. Okay, first one image. Second image you see, she's taking culture plate again. After taking culture plate, she's putting the colony on it. She put a swab culture there, right? And after that, she's taking a strip. She's taking a strip. Yes, this is a strip, which is called E strip, and she's applying on the culture plate. Okay, and then after that, she's incubating it inside the incubator. And next day, she sees this elliptical zone. She's seeing some elliptical zone like this. You see, elliptical zone. Now, let's see what are these things. These are 2 important tests, very important for the exam also. The first one, what did you see? It was called Kirby-Boyer disc diffusion measure, which is called Kirby-Boyer disc diffusion. Disc diffusion method. The important thing about this method is that it is usually we are using Muller-Hinton agar, and totally we are putting 6 discs we are putting here, and around the disc you have a zone called zone of inhibition. So based on that zone of inhibition only, you say the drug, whatever the drug you are putting. So Kirby-Boyer is for antibiotic sensitivity testing. Basically, it is called antibiotic sensitivity testing, AST we call. So based on the zone of inhibition, you tell the drug is sensitive or resistant or intermediate, you classify it. Okay, it doesn't talk about MIC value, it talks only about the sensitivity, resistance or intermediate of the based on the zone of inhibition. This second test on the other hand we call E test, E strip test or E test. This is basically what we do here is we are checking for the MIC value. MIC is minimum inhibitory concentration of the drugs. Okay, so here it is more better. Always MIC is better than the normal sensitivity. Based on MIC value, that minimum inhibitory concentration, we can save the patient from giving unnecessary extra doses and all, right? That's what is very important. So this is a E strip, and what you see around that is the elliptical zone. We call elliptical zone. Okay, so remember, this is E test and this is a Kirby-Boyer distribution. Both of are checking the drug sensitivity pattern. That's all. Okay, so you know this. No? So this image might come, so you have to be attentive with this image also. Get used to it. Yeah. Next one. Look at this image. This is very popular one also, very commonly asked one. So the first image you see, there is this peptone broth and she's taking some reagent, Kovac reagent, and she's putting there. And after that, what you're seeing? You're seeing a beautiful ring, you're seeing a beautiful indole ring. Okay, that's an indole ring. What you're seeing is an indole ring. Okay, now look at the second image. From the you see, first of all, the blood agar plate, what you see this colony from the blood agar, it's golden yellow pigment color. So golden yellow pigment itself, it's something must be striking in your mind. Let's talk about it. Okay. So after that, what happened? It's a Staphylococcus aureus, right? It's Staphylococcus aureus, and you pick the colony and she's putting it on the test tube, and you are seeing effervescence, bubbles. So when you see bubbles, it is what test? catalase test. Bubbles, catalase. Okay, when you see bubbles, it's a catalase test. She was adding on the hydrogen peroxide, 3% hydrogen peroxide, you got the bubbles. Okay, look at this one. Next one, again, I'm seeing the same type of colonies of golden pigment colony, and then she put it inside a plasma and she kept it in the incubator for 4 hours. 4 hours, see there, 4 hours it was there, and then she removed it out. And after removing, what is a beautiful coagulum? A coagulum or a clot is seen. So when you see a clot, that is coagulase test. When you see bubbles, it is catalase. When you see a clot, it is coagulase test. Okay, very important, two important tests. Now let's talk about what are the things and where it is popular. The first one, indole test, is very characteristic for Escherichia coli, E. coli test. In E. coli, in IMVIC test, if you remember, plus, plus, minus, minus. I is indole, M for methyl red. Volksbuchner and cited they are negative, minus, minus. Okay, that's opposite to Klebsiella. Fine. So in E. coli, they might give you history of UTI, or they must give you one of the diarrhea. No, they give one of the ETEC, EIEC, EHEC, EAEC, one of this E. coli variant diarrhea, and they might give indole test to find it. Okay, that's possible. Okay, it's an easy one, you'll get it. And when you see these catalase test positive for all staphylococcus. All the staffs, I told, all the staffs, they have cat in their house. So that is all staphylococcus. But when you see this is a coagulase test. This is a tube coagulase test. This coagulase is characteristic only for Staphylococcus aureus, not other Staphylococcus species. It is positive only for Staphylococcus aureus, right? If it is negative, we put it into cones, coagulase negative Staphylococcus. And that comes your Staphylococcus epidermidis and saprophyticus. Epidermidis mainly and also saprophyticus. Here all Staphylococcus are cat positive. If it's negative, then that would be Streptococcus. It could be one of the Streptococcus. So that's what it's important. Okay, catalase coagulase is a very important test to differentiate a gram-positive bacteria, Staphylococcus and Streptococcus, especially cocci I'm talking. Okay, fine. That's all. So this is also over. Now, next image. Look at this image. Also very important. You can see from the first one, what is happening here in this image. Okay, so there was, look at the, first of all, look at the plate itself. The plate itself somewhat looks like a greenish pigmented. There's some diffuse pigment there. It's diffused. Okay, and you know, when something is producing green color, blue color pigment, automatically your mind strikes. Okay, Pseudomonas, if you're saying it's correct, Pseudomonas. So now look at this. From that colony, Pseudomonas colony, they picked up and they're putting on some disc. The disc, you see, there's a blue purple color. Are you seeing blue purple color is formed? That is exactly. Okay, so this gives very clue about Pseudomonas. We'll talk about in a while. And look at the next image. Next image, it's a fluorescent shining. But you see, it's a bacilli, sort of beaded bacilli. Beaded bacilli and shining. Okay, beaded bacilli, shining. Okay, beaded bacilli, shining. So it is a fluorescent microscope. Fluorescent stain has been used. Fluorescent microscope, fluorescent stain. Okay, now let's talk about what are those two things you have seen here. So the first one, very popular question, this is oxidase. When you see this blue or purple color positive, that is oxidase test positive, plus you saw pigmented green or blue pigment, usually green pigment in the culture plate. So if this you see, this is very characteristic for your Pseudomonas. So what maximum they will give you? They might give you one of the burns history of burns might be there, or there will be any infection. Your otitis, malignant otitis externa in the ear for diabetes mellitus patient. Very popular question. Uncontrolled diabetes, malignant otitis externa question can be, or they can give you ecthyma gangrenosum, or in fact they can give you ventilator associated pneumonia, VAP we call, because pneumonia causes almost every diseases. It can cause UTI, anything they can give you, and give you this oxidase you see positive. It's maximum according to, you should see the history also, it's mostly Pseudomonas only. Okay, fine. It can be a possible Vibrio and other bacteria also, but for this history, this whatever burns and diabetes, this malignant externa, ecthyma gangrenosum, VAP and all, you'll think about Pseudomonas. Okay. Now, the second one, what you saw was a fluorescent microscopy. Itself is a question. They might give you identify which microscopy is this. That is fluorescent microscopy. You were seeing the bacilli, that is fluorescent stain. Fluorescent stain, but here the clue was only, it was like a beaded appearance. You know, when it's a beaded appearance, that is, we're talking about the Mycobacterium TB. In Mycobacterium TB, the normal stain is Zn stain. In Zn stain, you see beaded appearance. Same way here, they have used fluorescent stain. So now what is the fluorescent for TB? You know very well, that is auramine and rhodamine. Auramine and rhodamine stain. That's all. Very simple. So what will have, definitely you're going to have a history of TB there. So definitely they're going to give you patient had a cough with blood in the sputum, blood is sputum, okay, and fever, chronic fever, weight loss, all the symptoms will be given. Or sometimes they might give you history of HIV was positive. If this history comes, you think about fluorescent microscopy or MTV. Okay, that's all. And other things, acridine orange is for malaria and calcofluor white is for the fungus. Okay, fungus, also acanthamoeba. That's all. So these are very easy ones. So no mistake. I know you all know this. Just only to to confuse in the exam. Okay, it's all there. It's all in the images. We have discussed a lot this thing. Now another very important sure question is your sterilization process. So first we'll talk the image and then we come. Look at the first image. So someone, what happened? There's a door. He's opening, and I'm seeing there the rack, and there are some glasswares. Glassware is a clue for me. So, and also it's written there, it is a hot air oven. Whenever glassware comes, you think about hotware oven, right? So it's already mentioned there. It's a small, like a box, and then you're putting all these things. Okay, fine. Look at the second image. In second image, a flask is passed through the thing. Okay, it's a flaming. Okay, this is a flaming. We'll talk about flaming in a while. Okay. Third one, you see, the technician is taking the loop and he is making a red heat. It's a red heat. Okay, another method. Okay. This one definitely, very popular question. So a big, huge vertical. This is an autoclave. So this technician is putting all the instruments into the autoclave and he is closing it. Okay. This is the horizontal one. We have vertical also, which is used in the clinics. This horizontal is used in the hospital. Okay, we'll talk about it. And this one, it's already mentioned inspissator, but also you see when something is placed ulta, like a sliding way, not straight, but in a sliding way like this, that's a clue for inspissation or tyndallization methods. Okay. So now what is important here? We will see. So first one, when this image comes, the first one, that is your hot air oven. Hot air oven means it's if the temperature is important, 160 degrees Celsius for 2 hours, very characteristic. And all the biological news I'm not talking now, all hot Fmge, that is atrophius, subtilis, okay, all those things, okay, globig, all those things will come in the hot tetani, clostridium tetani, not globig, tetani will come, right, clostridium tetani, okay, fine. This one, flaming. So hot air oven, we remember it as anything glassy, anything glassware, anything swabby, any swabs you're putting, or any sharp instruments we're putting, anything liquidy, liquid paraffin, Vaseline, oil, all liquidy, oily, and gloves powder. Anything powdery, gloves, powder. All these things are very important things they might ask indirectly and mention. So this is for flaming. F for flaming. Flaming is usually for the test tube, mouth of the test tube mouth. To prevent the bacteria entering inside, we are passing through the flame in the labs. This red heat is the inoculating. This is a red heat. Red heat was a previously asked question. So this is for inoculation, usually for inoculating wires and loops. Basically for the wires and loops, we are using it. Okay, that's it. This is your most popular autoclave. Autoclave temperature is very important, 121 degrees Celsius for 15 minutes and 15 pascals pressure. Okay, that's the characteristic one. Here, most important is in culture media. All the culture media goes there. With that, of course, you can put all your all the recyclable plastics. Okay, all the plastic items you're going to put recyclable place. All the things are going to put it there only. Okay, that's it. This is very, very important one for your culture. Of course, you can put a surgical instruments also. Surgical instrument. Apart from hot air oven, you can put it in autoclave also. Main. Okay. Now, this is the characteristic one, but you can see this media only. A clue is the LJ media here. So you know that LJ media and LSS media, how they are sterilized. They are not sterilized by autoclave. This is an exception. You use inspissation. Or you use tyndallization. Inspissation, we know it is 80 to 85 degrees Celsius. Tyndallization, I told you, remember 10 into 10, so that is equal to 100 degree. So 100 degrees Celsius. So for either you use tyndallization or inspissation, whatever. Okay, both are correct. That's all. So this is very important videos. If they want to ask in the sterilization, you might get it. Okay, now look at this. This is genetics. One question. Sure, you will get it. Okay. So I don't know, image, they'll definitely have a question, but it will be image or video based. That totally depends on the examiners. Okay. So we will be thorough. And you guys also know it very well. Otherwise, also it's a quick revision you're going to do. So look at this. So first image, I'm seeing two bacteria. The first bacteria is making a pillei and they're fusing together, right? And this plasmid from this bacteria is going, this positive bacteria is going to the negative bacteria. That's all, right? Very simple. So main thing is in center, I'm seeing a conjugate conjugation tube or sex pili. So that is the conjugation mechanism, you know very well. Look at the second image. Second image here, you see, here is this two bacteria, okay, and one bacteria is releasing some plasmid substance freely floating, and that free substance is taken by other bacteria. Okay, you're getting, no? The clue is this only. It is releasing the free substance. It is releasing the free, some free plasmid is going there. Yes, look at this placement. It's going. So something in the environment is freely floating. It's taking is it. Whenever something free comes, it is transformation. Transformation. Okay, that's the clue I gave you. And look at the third image. In third image, bacteriophage is involved and it's going inside. The viral genome is penetrating and it's going inside. It combines with the bacterial genome, that is bacterial chromosome. Okay, so chromosome, the whatever thing, the genetic material coming from the bacteriophage virus is going to bacteria and coming from a prophage. Whenever it's a prophage, that is called lysogenic conversion. Okay, this is a specialized transduction. It's a transduction, but specialized transduction is lysogenic. Look at this one. Here also bacteriophage is coming. So it's a type of transduction, definitely. Now the phage is integrating with the bacterial chromosome, and then they make their own babies, combined babies, and then the bacteria is killed. So that is a lytic cycle, which is called generalized transduction. Okay, so this is one question which you're going to have it if image is going to come this time. Okay, easily they can ask. Examiners all love this one. Okay, so let's now write a little bit and revise it quickly. So you know this one, the first image we call it as a conjugation. Conjugation we call. So conjugation, because the conjugation tube, the characteristic example is E. coli. E. coli. So for UTI, it's very, very important role it has. Okay, conjugation E. coli, very important. Fine. This one, second one, the second image, the second one. The second, okay, it's not coming. The second also transformation, because a free genetic element has been taken from the environment is a transformation. So transformation is very characteristic for Shin bacteria, I told. Especially the first one is Streptococcus pneumoniae. Streptococcus pneumoniae, because these are capsulated bacteria. So that capsule is the one, the genetic element freely in the environment. So this non-virulent takes it and becomes virulent. Okay, so Streptococcus pneumoniae, characteristic example. FF, transformation, free genetic material, free plasmid in the environment, okay, from environment. Here, because of prophages forms, is a lysogenic conversion. Lysogenic conversion catches for many bacteria, but very important for diphtheria. Diphtheria toxin is becoming the non-toxigenic, become toxinic because of this phage only. So diphtheria toxin 1, Vibrio, I told, Viba, scarlet, Viba sleeps in scarlet bed, I told. Okay, scarlet, that means Vibrio is there. Scarlet fever is another example. River, this is very common. But of course, your botulinum toxin, also E. coli toxin, they're all are lysogenic conversion for mediated only. Okay, so this is very, very important one. And also Shigella, don't forget Shiga toxin, also Viba and Sheila, they need scarlet bed to sleep. That's all. Okay. Now the last one was this lysogenic conversion is called specialized transduction. Specialized transduction. That still it's a duction only, specialized transduction. But this one is generalized transduction. Generalized transduction, which is also called lytic phase or lytic cycle, because the host cell is getting lysed, the bacteria is getting lysed. So transduction, we told, remember, yes, B for duction, B bacteriophage is involved, though both the cases bacteriophage is involved, yes for 2S, you have to remember. Staphylococcus aureus, excuse me. And your Salmonella typhi. Staphylococcus aureus and Salmonella typhi. Okay, that's it. These are important. Okay, so very easy, you're going to remember it. Okay, so that one question guaranteed come in your exam. Okay. Now, almost we are done. Few things left, I think. Yeah, this only. So look at this test. This is now more immunology we are going now. So first one, you see O titer, AH. You see here, using O titer and down is this is not showing. Okay. O titer, H titer, AH and BH, and then positive control, negative control. So this one, this O and H comes, what is your mind? It is Vidal test. Yes, the Vidal test for typhoid fever. So say O is the common O O is a common, H is different for all three species. O is common for Salmonella typhi, but H is different for Salmonella typhi, paratyphi A, paratyphi B. So different. So in this case, only O is positive, that doesn't matter. So just see, this is a positive control, negative control, PC and NC. Okay, this one. Next one, a smear is there, a drop of blood is put. You're taking another slide and you're just sweeping it. So this is a thin smear, okay, thin blood smear. Okay, now let's talk about it. Let's write about it. Now here you see the first one. This is a slide Vidal test. Slide Vidal test. Usually we do tube, but you slide first and then we can go for the tube. Okay, usually. So this is slide Vidal test because you're seeing O antigen, AH and BH, all things you're seeing. So this is, in this case, only O is positive. So that is simple typhoid fever. If they give identify what type now in Vidal test, just because O is positive, it says typhoid fever. Rest all negative. But if they are also positive, any one of them are positive, H or H, accordingly you say it's typhi. You species it by saying typhi A, typhi B, or whatever you want to. So H is for speciation. H is for speciation. Vidal test for typhoid fever caused by typhoid fever or enteric fever caused by Salmonella typhi. That's it. Okay. This image we told that's a thin. It's a thin smear, thick smear, thin smear. So this is a thin smear. So in thin smear, if you're going to usually you put Giemsa stain and check for the parasite. It's very characteristic for at least malaria. For malaria, thin smear is used for speciation. To speciate, it is caused by Plasmodium vivax or Plasmodium falciparum or Plasmodium ovale or Plasmodium malariae to identify speciate. Okay, speciation. Whereas if thick smear, in thick smear, we don't do this sweeping and all. We just put the blood and put it into saline, you put it into the NS solution and then you just take it out and stain and see. So this is for checking the number of parasites, to check the number of parasite for endemic purpose, to check whether it's endemic or not. Okay, endemicity or all those things in PSM what we do. Okay, so thick smear and thin smear, thin and thick. Okay, this is very, very important. So you notified it. Yeah, just in case if this question comes. The last one, the last question, you see, this is one popular test frequently asked also in your exams. Look at this image. So this doctor is taking a string and giving to the patient. There's a capsule there, right? A capsule is going inserted till the duodenum only. See, till only the duodenum. And she's leaving it for some time. After some time, they removed out. You see the capsule has come out. Okay, the capsule has come out now. And after capsule is coming out, yes, that's all. Okay, the capsule has come out. She's taking and checking for the parasite. So you know very, very well, this is a string test or called entero test. This is the string or entero test, which is very, very characteristic for Giardia. Giardia we are doing. Okay, that's a capsule test, entero test. So many, some people also call it as capsule test also. So when you put the thing capsule inside, leave it in the duodenum. D for duodenum, so it goes only till duodenum, not jejunum or anywhere. That question is asked. And after that, you take out and make a smear and look for this beautiful the motility or whatever we saw. No, that is falling leaf Giardia. Falling leaf motility Giardia with the 2 nucleus and 8 flagella. You have to check it out. That's all. So this is the questions. Okay. So this is commonly popular among examiners, but still, you know, even there's one more I have not added. They might give you a colony of this in a culture plate, and then they might use a string and try to lift it up. Okay, lift it up. When you lift it up, you form a string-like structure is formed. When the string is formed, it is usually Vibrio cholera. Vibrio cholera more, and also sometimes Klebsiella also. Klebsiella directly comes. Vibrio cholera, you have to add a little bit bile and all and mix, whatever. So the string test positive is characteristic of Vibrio cholera. Another point to be noted. Okay. So these are things, doctor. So please go through just once. You go through all these things, okay? Because you know all the things under portions that you know very well be revising. But this images, videos, you should make mistake, okay? Because you know already. Only because you didn't see the video, you might think you haven't done. Okay. So careful, and once again, all the best. Do well. We'll meet in another session soon.